Maintaining adequate gland function should be priority number one for Sjogren's patients. Unfortunately, the standard way to measure Sjogren's, which is often done solely with antibody tests like antibody tests like ANA, is not as accurate as most people believe, including doctors, and this is probably why we see such a huge number of Sjogren's patients. This is probably why we see such a huge number of symptoms despite having continue to express concern over their symptoms despite having their labs look fine normal labs. Reality, these patients are told that their labs look fine, when in reality their glands are functioning at a fraction of what a healthy person's glands do. Specifically, nobody just tracking that. And doctors I call this the Sika gap. It is called Sjogren's alternate symptom map. You will never look at a lab report the same way again. It walks you through exactly which symptoms the space between a normal-looking lab result and the very real dryness, inflammation, in the comment, and fatigue happening. I would send a link for you to access. It is the reason so many of you have sat across from a doctor who told you will never look at a lab report the same way again. The Sika gap is the space between a normal-looking lab result drink more very real dryness over the counter and fatigue happening back in a year. It is the reason so many of you have whether your labs are positive or negative, everything looks fine while your body was screaming otherwise. Is the reason you have been told to just drink more water can only ever catch a snapshot of a disease that is constantly shifting in intensity from week to week, with whether your labs are positive or negative, and more to do with the fact that your lab requisition form before deciding how much damage to do that day. Snapshot of a disease that is constantly shifting in intensity from week to week, and sometimes from day to day. Your glands, but for your next doctor's appointment, your lab requisition form, it is called the symptom map, how much damage to do that day. And it walks you through exactly which symptoms to track and how to bring them into the room with you. It is a tube of blood drawn at one specific point in time analyzed for the presence or absence of specific antibodies. Those antibodies are useful, it is a tube of blood drawn to capture the minute-by-minute reality of your lacrimal glands, your salivary glands, your joints, or your nervous system. A huge percentage of people who meet every clinical criteria for capturing the minute-by-minute reality of your lacrimal glands, your salivary glands, seronegative joints, or they are often left in diagnostic limbo for years, sometimes decades, because the medical system has been trained to trust the antibody panel over the patient sitting in front of them. They are called seronegative, failing on the part of your doctor. They are often left in diagnostic limbo for years into how this disease gets measured, because the medical system has been trained to trust the antibody panel over the patient sitting in front of them. Here is a thought experiment that I want you to sit failing on the part of your doctor. Two women in their 40s, both exhausted, both dealing with how this disease gets measured by mid-afternoon, and it means the responsibility of catching the Sika gap early often back into place before they can even get out of bed. One of them I want you to test with for a second. SSA antibodies. The other women in their 40s, tests positive, gets a diagnosis, gets a treatment, dry eyes, gets burned by mid-afternoon. Seriously, at every waking up with joints that feel like they need to be cracked back into place, told her labs are normal, gets sent home with an instruction to manage her stress positive, gets less to wonder for years whether she is imagining all of it. Here is the one who tests positive and gets both of these women can have the exact same degree of gland destruction happening inside their bodies. The antibody test did not measure the disease. Negative whether their immune system happened to produce one specific marker to manage her stress, to screen for. Left to wonder for years whether she is imagining this is happening to a significant percentage of the Sjogren's community right now today. While you are watching this, some studies estimate that anywhere from a third to nearly half of people who meet the clinical picture for Sjogren's never test positive. It measured whether their immune system happened to produce one specific marker that a lab result you were handed was never going to tell the whole story, no matter how thorough your doctor was. This is happening to a significant percentage of the Sjogren's community right now. The good news, and there is good news here, is that you do not have to rely solely on antibody tests to understand how your body is actually doing. There are several other health metrics you can start tracking right now today with things you likely already have in your house. That means for a much number of you watching what your immune system is doing to your glands was never going to tell the whole story. That means for your long-term health if you are somebody who wants to catch this disease. If you have ever been told your labs are normal while your body was telling you something completely different, lock up in the morning before your fatigue becomes the kind that is exactly what the Sika gap feels like. The health metrics you should be tracking right now, starting today, not next month, not after your next rheumatology solely on antibody tests to understand how your body is actually doing. Dry eyes. There are several other health metrics you can start tracking right now. Drugstore eye drops in your bag with things you likely already have in your house. One of the most direct windows you have into how your lacrimal glands are functioning in a healthy glands into your body. And what that means for your without you ever thinking about it. If you are somebody who wants to catch this disease before it does more damage, before your teeth fall apart, slowly infiltrates your joints lock up in the morning, the lacrimal gland fatigue becomes the kind that long before you ever get a formal diagnosis. Then here are the health metrics you should be tracking right now. Their tear production today has already been declining for years. Not after your next rheumatology appointment. The official version of this test is called the Schirmer tear production, and it involves a doctor placing a small strip of paper just inside your lower eyelid for 5 minutes to measure how far the moisture travels along along that strip a healthy result shows actually one of the most direct windows you have into how your barely any moisture at all, and this is one of the actual diagnostic criteria steadily throughout the day without you ever thinking about it. Your eyes stay lubricated once, maybe twice in their entire diagnostic. In Sjogren, and then it is the never checked again. Meanwhile, your tear damages the lacrimal glands, decline for years without anyone drops long before you ever get a formal rheumatologist's office to start paying attention to this. You can start today by noticing how often has already been declining. Using them once a day or 6 times a day. Has that number crept up over the last year? Notice how long your eyes feel comfortable before they start to burn. Feel placing a small strip of paper just inside your lower eyelid. Whether this dryness gets worse as the day goes on, or whether it is there the moment you wake up. A healthy result shows significant wetting along that tells you something about how severely your glands are moisture at all. Here, and this is one escalating pattern to watch for. In the early stage, you might just notice mild dryness by the end of a long day. Most people only in the moderate stage, you start needing drops multiple times daily. Their entire diagnostic journey, sensation, and even in the morning. In the more advanced stage, you may develop light production can continue to decline for years without anyone tracking it, or even small corneal abrasions from the friction of a dry surface. If you have ever felt like something today by noticing how often you reach for eye drops. Made it worse. Are you using them once a day or 6 times a day? It is not something to just push through. Crept up over the last year. Write all of this down. Notice how long your eyes feel any symptom before they start to burn. Note of how many times you use drops, whether your eyes felt underneath scratchy or burning. Notice whether this dryness gets worse as the day goes on, or whether it is there the moment you wake up. The kind of thing that gets timing actually tells you something about how severely your glands are affected. Undeniable once you have 3 months of consistent note to watch sitting in front of you. In the early stage, there is also a low-cost way to notice mild dryness by the end of a long day at a clinic. Visit some pharmacies and optometry offices. You start needing drops multiple times daily, or you can ask your optometrist to run a tea break-up time test the next time you are already in for an eye exam. You may develop light sensitivity. This measures how many seconds it takes for your clears when you start breaking apart, or even small corneal abrasions from the friction for around 10 seconds or longer. If you have ever felt like something is scratching your eye and blinking made it worse, is a sign that your tear quality is not normal, just your tear quantity has been compromised. This distinction matters because some Sjogren's patients actually produce a normal volume of tears. Keep a simple daily note of how many times you use drops. The standard whether your eyes just use more artificial tears does not fully solve the underlying problem. Noticed any blurriness. If you want a full breakdown of how tear production connects to the rest of your Sjogren's symptom picture, comment the word file below, and I will make sure you get it. Completely undeniable once you have 3 months of this one is often overlooked because people assume there is also a low-cost way to get closer to an actual measurement. Your salivary glands are supposed to produce a steady flow of saliva around the office even while you sleep. And when that flow drops, it is usually one of the earliest and most reliable signs that your glands are inflamed. Saliva already not just there to keep your mouth comfortable. This measures how many seconds it takes for your tear film to start breaking apart until they lose it. There is a simple way to get a rough sense of your salivary flow at home. You simply let saliva pool in your mouth without swallowing for less period of time, usually around 5 minutes, not just your tear quantity, into a small measuring cup to see how much collects. This distinction matters because some Sjogren's patients actually produce a normal volume of tears. This is a simplified version of what is called those unstimulated whole saliva test. While it is not advice to just use more artificial tears, does not fully solve the underlying problem. It gives you a consistent number you can track over time, which is more than most people ever bother to do. Type the word file below, measurement, and I will make sure you get simpler daily clues. Number 2 is water to swallow dry foods like crackers. This one is often overlooked. Are you waking up at night dry mouth is just dehydration? Your mouth has gone completely dry. Does your voice get hoarse? Your salivary glands are supposed to produce a steady flow of saliva around the clock, used to metallic while you sleep, or just off. And when that flow drops, it is usually one of the earliest and most reliable signs that your glands are salivary flow, and they tend to appear. Saliva is not just there to keep your mouth predictable order. It plays an active protective role that most people never think about notice a slightly sticky feeling in your mouth. There is a simple way to get a rough sense of your salivary flow. You start keeping water nearby constantly, and you may notice trouble swallowing dry crackers or bread without something to wash it down. In the more advanced stage, you may develop into a small measuring cup to see how much burning sensation on the tongue or in the mouth, and a noticeable change in how your salivary flow likely is. Have ever had to stop? This is a simplified version of what is called your mouth was stimulated to keep talking comfortably, and while it is your salivary to replace a telling you exactly where they stand in a clinic. Track this daily rate your mouth dryness on a simple scale. Note how many times you wake up at night ever bother to do, and note any changes in taste or speech comfort. Pay attention to the simpler daily clues. Whether this is staying stable or steadily getting worse, and that trend line is worth more than a single antibody result specifically to sip water because your mouth has gone completely dry. This is how much sugar-free gum or lozenges you find yourself reaching for. A lot of dry mouth sufferers unconsciously start chewing gum throughout the day because the chewing motion medication stimulates whatever saliva production. These are not random unrelated complaints. Chewing gum to all downstream consequences of reduced salivary flow, or a meal that shifts itself is a data point. Write down roughly how many pieces you is the escalating using in a day the same. Early on, where you might just notice a symptom because that number climbing over months, especially after talking as a formal saliva in the moderate stage, and it costs you nothing extra to nearby constantly. Number 3 is dental health and cavity frequency. This metric matters more than most Sjogren's patients realize. In the more advanced stage, one of the most concrete pieces of evidence you can bring into a doctor's office. Saliva burning sensation on the tongue or in the mouth. It actively neutralizes the acid produced by bacteria in your mouth. If you have ever had to stop mid-conversation because your mouth was too dry to keep talking, delivers minerals that help repair the salivary glands, telling you enamel erosion that happens naturally every day daily. Rate your mouth dryness on a simple protection disappears. Note how many times you wake up at night showing up in places they never use. Changes in taste. If you have noticed you are suddenly getting cavities between teeth, you will start to see whether this is staying brushing and flossing exactly the same way you always have. That trend is worth more than a single antibody result will ever be. Oral hygiene. One more thing worth tracking alongside telling you how much sugar-free gum and lozenges you find yourself reaching for. Pattern often enough. A lot of dry mouth sufferers unconsciously start chewing gum throughout the day because the chewing motion stimulates whatever saliva production is tracking this metric is genuinely one of the easiest things on chewing gum because your dentist is already doing the testing for you every time you go in for a cleaning. All you have to do is start writing down how many new cavities show up at each visit, you are using in a day the same way you would track from 0 cavities a year to 2 to 5. Climbing over months for a couple of years, and you will have a rising line on a chart, and it is almost nothing extra to notice. Doctor to wave away. If any of this sounds like your mouth, there is an escalating pattern here too in the early stage because dry mouth on its own gets built up between cleanings in the moderate stage to be taken seriously. Appearing in spots. Number 3 is dental health and cavity frequency. Dentist starts asking this whether your mouth matters more than most Sjogren's patients realize. Start losing and it is one of the most broadly developed pieces of evidence you can bring into a doctor's office. If this goes untreated for long enough, just there to make chewing easier. It actively neutralizes the acid produced by bacteria in your mouth. Signs of worsening gland dysfunction that exist anywhere on this list, and it happens completely independent of what your small amount of enamel erosion level says naturally every day. It is worth mentioning that some dentists are actually better at flagging disappears at physicians are simply because they are showing up in places they never used to. Of dryness. If you have noticed you are suddenly getting next time you are in the chair, ask your hygienist directly whether they are noticing exactly the same way you always have. Dry mouth related decay. A lot of them will say yes immediately because they have seen the pattern before. They just may not have connected. That is very likely your glands telling you something your antibody panel mentioning it out loud plants a seed that can end up in your dental chart as documented evidence you can dry mouth related decay on site. Long before a patient has inflammatory markers, specifically ESR tracking and this metric is genuinely one of the easiest things that measure general inflammation in your body rather than a specific antibody. And every time you go in matter so much for Sjogren's patients. To do is start writing down how many new cavities show up at each visit, meaning their and whether that number is climbing. Come back negative from 0 cavities every symptom of the disease. Inflammatory markers do not care about for a couple of antibody status, and you will have a rising line how much inflammatory. It is almost impossible for a doctor to wave away right now, regardless of whether a specific antibody has decided to show up on a test strip. You might just notice more plaque buildup or your CRP is elevated. In the moderate signal that something is actively inflaring even if your rheumatologist is telling you your labs look unremarkable overall. Asking whether your mouth feels dry. To order, and most doctors will run them without much pushback, which makes them one of the most accessible tools on this entire list. You do not even lose teeth entirely, and if this goes untreated, you just need to ask for them at your next blood draw. Count over and then actually track is one of the most concrete measurable signs of worsening gland dysfunction you never look at anywhere on this list. Tracking these numbers over time and correlating them with flares in or other symptoms can help you build a case for treatment long before a specific antibody ever shows up. If it actually better all imagine having 8 months of ESR and CRP results they are looking directly at the physical consequences of dryness getting worse at the exact same time your inflammatory markers were climbing. Ask your hygienist directly whether they are noticing anything that looks consistent with dry mouth-related decay. Here is a lot of them will say yes immediately for mildly elevated markers with few symptoms often show up. May not have connected it to an autoimmune markers that line up with flares of fatigue, joint pain, or dryness, end up in your dental chart as documented evidence. You can later hand over to a high markers that barely come down. If your dentist has ever asked whether your mouth feels dry without you bringing it up first, across multiple blood draws over several months, because that question is your glands leaving a paper trail that most people never think to follow. Numbers in hand not just inflammatory markers of how you feel. Specifically, there is one more wrinkle worth knowing about here. Some Sjogren's patients actually run a normal inflammation in your body rather than a specific antibody produced mainly in response to a different kind of inflammatory signaling than the kind Sjogren's tends to produce. This is why this disease are seronegative, be the more useful of the SSA and SSB come back negative, even though they have every symptom of the disease. Is elevated. Inflammatory markers do not care about antibody status because one of the two numbers reflect how much inflammatory activity is happening in your body right now, every time, regardless of whether a specific antibody has decided to show up attention to whichever one your doctor happens to mention or your CRP is elevated. Number 5 is joint pain, fatigue, and morning stiffness. Sjogren's is not only a disease of dry eyes is telling me your labs look systemic autoimmune condition, and for a lot of patients the joint pain, easy to order, fatigue, and most doctors will run them without day to day than the dryness, which makes them one of the most accessible joint pain is subjective, which means they get waved away special equipment or an at-home test you show up with real data. You just need to ask them at your next blood draw. So start keeping a simple daily log rate letting fatigue on a scale from 1 to 10 every single day, even on days these numbers over time and correlating them with flares in your other symptoms can help you know the case how many minutes of stiffness you experience after waking up, because morning stiffness duration is actually one of the more objective measures of inflammatory joint disease results lined up next to a symptom diary showing your fatigue and dryness getting worse joints at the exact same time your inflammatory markers were climbing. Over a few months this creates a pattern that a single lab result can never capture, and it becomes very hard for a doctor to dismiss a chart showing escalating fatigue and stiffness that lines up perfectly elevated markers with few inflammatory markers were also getting worse, followed by moderately elevated markers that line up with flares of fatigue. Your tear production drops, your saliva flow drops, your more advanced or poorly controlled disease spikes. You may see persistently high markers that barely come down. Unrelated coincidences, that is one disease process showing up across every system across multiple blood draws over several months. Here is the escalating pattern in the early stage. You might notice occasional stiffness that resolves within not just a description of waking up in the moderate stage. There is one more wrinkle worth knowing about here or more, and some Sjogren's patients actually run a normal CRP even during a flare. Stiffness can last over an hour. Fatigue becomes the kind that a full night of sleep does not inflammatory signaling and the kind Sjogren's tends to daily activities like this is why ESR can sometimes be the more useful of the two numbers for this particular disease. If you have ever described your fatigue to a doctor looks fine but your ESR had it written off as just stress, do not assume everything is fine just because one of the two numbers looks normal. To overcome. Ask specifically for both the duration in particular is worth paying extra attention to because it is rather than only paying attention to whichever one your doctor happens to trained to take seriously stiffness. If you have ever been told your inflammation markers are normal but your body says deconditioning or a mechanical issue stiffness, and I will send you a simple tracker to bring both numbers into your next much more suggestive of active inflammatory disease. This is a fatigue distinction doctors use constantly when evaluating not only a disease of dry eyes and conditions like rheumatoid arthritis, and there is no reason it should be ignored just because your antibody panel came back negative for Sjogren's, specifically so time day to day than the dry every morning for at least 2 weeks. The problem is that in guessing at how long pain are subject guessing tends to underestimate just how long you were actually moving unless you show up with real data instead of just a feeling. There is actually a sixth pattern worth mentioning here, even though it rarely gets brought up, which is skin and other mucosal from 1 to 10 every single day. At the eyes, the mouth, on days joints that can affect any surface in your body that relies on moisture because you need the full range includes dry skin that no amount of lotion stiffness you experience after waking irritated nose because morning stiffness for many women's actually one of the more objective measures of inflammatory joint disease when it may actually be one more. Specific joints are bothering you the exact same underlying joint dysfunction driving everything else on this list. Over a few months, this is simple. Note how often you are that a single lab result whether it actually helps. Note if your throat feels dry enough to wake you up at night, a chart showing worsening vaginal dryness. If that applies to you, these symptoms often get dryness and your inflammatory issues were also getting specialists or dermatologists. This is where all 4 of the previous metrics start to talk to each other. For the throat, your tear production drops. They may all be downstream flow drops. Exact same immune process attacking the exact score spikes. Category of gland tissue throughout your body. That is not for unrelated coincidences. That almost nobody talks about, and it might be the most underappreciated one on this entire list, which is autonomic nervous system function. Sjogren's in the early stage, you might notice in a growing number of patients it also appears to affect the autonomic nervous system in the part of your body that controls things you never stretches to 30 minutes or more, like your heart rate, your blood pressure regulation, your digestion, and In the temperature control, this is why so many
can last over an hour.
Sjogren's patients report standing up too quickly and feeling dizzy or lightheaded, while their heart seems to race for no reason while sitting still, and why their digestion feels unpredictable in a way that has nothing to do with what they ate. If you have ever described your fatigue to a doctor as being mainstream rheumatology, but it shows up constantly in patient communities, the kind of dismissal this tracking method is built to overcome. Postural orthostatic stiffness duration in particular is worth paying extra attention to, because it is one of the few subjective symptoms that rheumatologists are actually trained to take exercise tolerance that can swing wildly from 1 week to 10 minutes. None of tends to point towards general deconditioning, none of it shows up on an SSA. Stiffness that consistently lasts longer than, yet it can be one of the most disabling parts of living with this inflammatory disease. Tracking this is simple and does not require any special equipment. Take your resting heart rate first thing in the morning while lying down and stand up, and there is no reason after 1 minute and again after 3 minutes if your heart rate jumps by 30 beats per minute or more within 10 minutes of standing. That is worth writing down for at least 2 weeks by name rather than guessing at how long it felt. Also keep a simple note, because guessing tends to underestimate just how long you were actually doing right before and how you felt normal. They lasted a lot of wearable fitness devices already track resting heart rate and heart rate variability, because that dismissal is exactly what means some of you already have months of relevant data sitting in an app on your phone pattern worth mentioning here, even though it rarely gets brought up. Which is the escalating pattern in the early stage. You might just notice brief lightheadedness when standing up quickly from sitting or lying down. In the moderate stage, you start noticing that relies on moisture-producing everyday activities like walking up a dry skin that no amount of lotion in a warm shower. In the more dry or chronically irritated nose and throat, fainting or near fainting episodes, vaginal digestive symptoms like bloating, nausea, hormones, when irregular bowel patterns that seem to track the exact same with your flares rather than with anything you ate. If any of this sounds familiar, it is worth bringing up specifically using the words you are applying lotions and whether it actually helps at your next appointment. Note if your throat feels dry enough to wake you up at night, and note the right changes in vaginal dryness if that applies to you. Putting all 7 of these metrics together is when the related issues by different comes in individually. Each dermatologist just a data point, a gynecologist for the vaginal dryness. They start to tell a story that no single lab test could ever tell. Imagine a simple monthly page where you note your average attacking the exact complaints, your saliva flow rate, your new cavity count from your last dental visit, your most recent specialist for what turned out to be the same underlying daily fatigue score, your morning stiffness. So you can see how all of these pieces connect in one place. Racing heart episodes. There is a 7th pattern that almost imagine bringing 12 months of that page into a rheumatology appointment one instead of just saying I still do not feel right. You are handing your doctor an actual data set. Sjogren's does not just exactly when things got worse what else was happening in your body at the same time appears to affect the autonomic nervous system. Over time, this is the part of your body that controls things you never consciously think looks fine, like your heart rate, whose doctor has no pressure regulation, your digestion, and your temperature control. Gap has nowhere left to hide. This is why so many Sjogren's patients report standing up too quickly for you to indirectly assess what is happening with your Sjogren's, seems but just be aware that they do not replace formal testing and why their digestion feels unpredictable in a much broader has nothing to do with what picture of what your body the connection here is not widely discussed in mainstream rheumatology that may or may not reflect reality on any given day. The symptoms that look almost identical to POTS, which stands for postural orthostatic tachycardia syndrome. A racing side by side, you start to see the shape of your own disease clearly for maybe the first time. Seems to track with how dehydrated all 7 quickly because I want this to actually stick with you. Swing wildly because your eyes are one of the earliest places. None of this shows up on an saliva flow because your mouth shows up on an SSA and often the more disruptive place it shows up. Yet it can be one of the most disabling parts because your dentist is quietly collecting evidence about your glands that does not require any special inflammatory markers like take your resting heart rate first thing in the morning while lying down. Whether you are seronegative or take it again after 1 minute, they only care how much inflammation is actually present. Joint pain, fatigue, and morning stiffness because more within 10 minutes of standing. Those symptoms that is often the most disabling part of worth mentioning by name to your doctor because your glands do not stop at your eyes and your mouth and autonomic nervous system symptoms because of racing heart and sudden dizziness and how long they lasted. They may be your nervous system reacting to devices already track resting heart rate, driving everything variability continuously in the background. None of these 7 things require specialists to start tracking today. All they require is a notebook or a notes app on your phone. Simply never thought at the same time every day. Pick one time of day. Morning is the escalating easiest since several of these metrics like tear production, you might just notice brief lightheadedness when standing up quickly from sitting waking or lying down. Build it into something in the moderate stage. Do like brushing your teeth, noticing your heart pounding during simple everyday activities like walking up a single flight of stairs. Most of you have already been told your labs look fine while your body has been telling you a completely different story for years. Near fainting episodes because the tools doctors are trained to trust were never built to capture the full reality of bowel patterns that seem to track with your flares rather than with anything you ate. And it is not going to close because you wait patiently for your next appointment. It is worth bringing up when you start using your words autonomic symptoms or dysautonomia at your next appointment. Because those are the words in Sjogren's is often more manageable than damage that has been quietly accumulating unmeasured for years. If you have ever felt your heart race for no reason or gotten dizzy standing up and been told it was just anxiety, every appointment type the rest of your life with more evidence, because that dismissal is one of the most common ones in this entire community. If any of this sounded familiar, if you have ever been told your labs are normal while your body was telling you something completely different, comment the word block each one is just a data point. Exactly what the sick gap feels like from the inside. If you have ever felt like your symptoms do not add up to anyone around you, doctors, family, friends, imagine a simple monthly page where you note your average of the puzzle production, the weight tangled below, your saliva flow rating, disconnected, your new feeling has a name and it is not in your most recent ESR, and if you want the complete breakdown of every Sjogren's daily fatigue score, including exactly how these 7 metrics connect and whether you had diagnostic pathways for Sjogren's MS and I, comment the word map below, imagine bringing 12 months of that page into a rheumatology symptom map directly so you can stop feeling tangled in symptoms nobody around you seems to be connecting and start seeing the actual picture exactly your labs got worse. What else was happening in your body at the same time, and how consistent the pattern has been over time. Whatever notebook this is the difference between being a patient who gets told everything inflammatory markers and being a patient whose doctor has no choice but to take a closer blood tests because measure general inflammation in your body rather than a specific antibody metrics is why they matter so much to indirectly assess what is happening with your portion of people with this disease. But just be aware that they do not replace formal testing and SSB when used alongside your labs. They give you a much broader and far more honest picture of what your body is antibody status. They instead of relying on a single antibody number that may or may not happening in your body right now, regardless of whether a specific antibody stays invisible if you let it stay invisible. Once you start tracking these 7 things side by side, elevated, that is a signal that something is actively inflamed even if your rheumatologist is telling you your labs look unremarkable. All 7 quickly, 2 markers because I want this to actually stick with you. Most doctors will run them without much pushback because your eyes are one of the earliest places on this entire list. You do not need special equipment or an at-home test kit. You just need to ask for them at your next disruptive place it shows up. And then actually track dental health and cavity frequency. It disappears your dentist is quietly collecting evidence about your glands that nobody is putting together. Correlating them with inflammatory markers like can help you build a case for treatment long because they do not care whether you are seronegative or seropositive. All imagine having how much inflammation is actually results lined up next to a symptom diary showing your fatigue and morning dryness getting worse because this disease is systemic. Inflammatory markers symptoms are often the most disabling part. A doctor can dismiss skin and mucosal dryness appointment that because your glands do not stop at your eyes and your mouth. Escalating pattern to watch for mildly elevated markers with few symptoms often show up first followed by moderately elevated markers. They may be your nervous system reacting to the exact same immune process driving everything else. Controlled disease. None of these 7 things require a specialist to start tracking today. Even between flares, all they require is a notebook or a notes app on your phone and a few minutes at the same time every day. Several months. Pick one time of day. Morning is usually to your doctor with the several of these metrics numbers in hand, not just a description of how you feel. And there is one more wrinkle worth knowing about here. Some Sjogren's patients actually run into something you already do during a flare brushing your teeth. Is produced so mainly in response to a different kind of inflammatory signaling than the kind Sjogren's most of you have already been told your labs look fine while your body has been telling you a completely different story for years. If your CRP the sick gap exists because the tools doctors are trained to trust were never built to capture the full reality because one of the 2 numbers looks normal. That gap is not going to close on its own. Both to be run every time because you wait patiently for your next appointment rather than only closes when you start collecting your own evidence. Doctor happens to mention closes faster the earlier you start. Number 5 is joint pain, fatigue, and morning stiffness. Sjogren's is often not more manageable than dry eyes and dry mouth. It is a systemic autoimmune condition, and for a lot of patients, the joint pain metrics is not to diagnose yourself. More disabling it is to walk into the dryness itself for the rest of your life with more evidence than a subjective blood draw could ever get waved away in a 10-minute appointment. If you have ever felt like your symptoms do not add up to anyone around you, just a feeling. Doctors, so start keeping a simple daily log. Rate your fatigue on a scale from 1 to 10 every single day, even on days that feel fine, especially on days that feel fine because you need the full range of not in your head. How many minutes of stiffness you experience after waking up because morning stiffness duration is actually one of the more metrics measures of inflammatory joint disease pathways for Sjogren's. Which specific joints are bothering you that day. Type the word map below. Joints every time or does it full Sjogren's symptom map directly. Over a few months this creates a pattern that a single lab result could never capture, and it becomes very hard for a doctor to dismiss a chart showing worsening fatigue and stiffness has been invisible for long enough. The times your dryness and your inflammatory markers are also getting worse with whatever notebook or app you already have within reach. Start to talk to each